$43 trillion a year. 43 trillion. That's how much Americans spend on medical treatments for conditions such as heart disease, cancer, and depression. One doctor believes up to 80% of these illnesses could be avoided by addressing the root cause behind them. Medical reporter Lorie Johnson has the doctor's prescription.
After watching her mother suffer from poor health for decades, then die relatively young, Casey Means pursued medicine to help others avoid what happened to her mom.
She had seen her doctors faithfully, taken all the medications, done exactly what they said. But the reality is she never healed. She was being managed, but not healed.
After becoming a head and neck surgeon, Dr. Means became disillusioned with the entire process and walked away from mainstream medicine.
What I saw in the healthcare system is that we're spending more money every single year on treating diseases, but patients in America aren't really getting better. Our rates of chronic illnesses are going up every single year.
Dr. Means believes this is due to the system ignoring the root cause, what she labels metabolic dysfunction.
And this leads to every imaginable chronic disease we're facing today, from cancer to heart disease, stroke, Alzheimer's, dementia, type 2 diabetes, obesity, depression, anxiety, migraine, infertility, erectile dysfunction, you name it.
She explains in her book, Good Energy, that metabolic dysfunction refers to how cells make energy, right down to the mitochondria. Dr. Means puts a proper diet as the best way to avoid metabolic dysfunction or reverse it. Other habits, such as exercise and sleep, also play a role, but she says diet matters most. She adds if more doctors were to take an ultra-aggressive stance on diet with patients, many could avoid medications and surgery, although with the current system, that's unlikely to happen.
The average medical student in the United States does not take a single class in nutrition in medical school. So 4 years of medical school, 3 to 7 years of residency, and we are not talking about nutrition or lifestyle virtually at all. So there's this huge mismatch between what's causing diseases and then what doctors are trained to understand and treat.
After nearly a decade, Dr. Means switched from surgery to functional medicine, one of the few specialties that emphasizes healthy habits.
It's a lot harder to counsel a patient for an hour on their lifestyle and their diet than send them with a prescription for a pill.
Her advice begins with a warning about processed foods, which are found in packages and in many restaurants.
70% of the calories we're eating in the United States today are ultra-processed foods made in factories. And essentially, we should think of ultra-processed food as a recent experiment in human culture that has failed.
She recommends eating food close to what's found in nature and ideally cooked at home. So obviously, Andrew, it's not always easy eating that way, but Dr. Means points out one thing that also isn't very easy is having a chronic disease.
That was a fascinating story. I mean,
Right.
And to think that a lot of medical training, they don't take nutrition classes, et cetera, but that's a whole nother issue.
Yeah.
Now, you've talked a lot about the amount of sugar in processed foods. In fact, sometimes when I'm sugaring my coffee, I think Lorie would probably advise me against this. But what's another ingredient often found in processed foods?
That a lot of people overlook: refined seed oils, like soybean oil. And the reason these are harmful is because they can cause massive inflammation, which we know, Andrew, is the root cause of so many diseases. And also these oils can cause oxidative stress, which can damage our bodies at the most fundamental cellular level. Believe it or not, soybean oil is the #1 oil consumed by Americans today. It is in so many things. I could have brought in half of the grocery store when I was there, but as an example, the first thing that came to my mind was mayonnaise right here. The #1 ingredient, soybean
So we're
oil.
supposed to avoid soybean oil, but soybeans
right.
are healthy, aren't they? Not?
You would think, but the problem is the way they're processed in these giant factories, industrialized. They bleach them, they deodorize them, and probably most importantly, they heat them to these extremely ultra-high temperatures, which causes them to become rancid with free radicals. Not good.
So are there other processed oils we need to avoid? I'm sure there are.
Absolutely, they are. And so here are the ones that Dr. Means recommends avoiding. Over here, this is shortening, which of course we all love to cook our fried chicken in shortening. But guess what? The #1 ingredient of this particular brand of shortening, soybean oil.
Oh, go ahead. I'm sorry.
Then also next down the line, vegetable oil. This particular brand, the #1 ingredient, soybean oil. Then we have canola oil, corn oil, and peanut oil. These are all highly processed, industrialized oils. That I know, your expression is like, I love peanut oil. That's another great one for frying
oils
chicken.
Are kind of off limits.
They're kind of off limits, and they're also very cheap. This is why they're so popular in restaurants and packaged foods.
Are there some we can go to as an alternative?
Yes, absolutely. So
I'm
the
hoping
king
you
of
say
the
olive
hill,
oil, please.
Yes, the king of the hill, the #1 oil is olive oil. And the reason it's so good is because of these compounds that it contains called polyphenols. Polyphenols. And different olive oils, different brands can contain different amounts of polyphenols. This one right here, the Gundry olive oil, has 30 times the polyphenols as most olive oils because the olives come from Morocco. They have a lot of polyphenols that you have to buy online. Dr. Means likes this brand right here, Spectrum. This is available in most grocery stores. And she says, when you're looking for an olive oil, do look for the dark bottle because sunlight can oxidize the oils. Look for first cold pressed. Organic is always nice, but also look for single sourced olives because a lot of these olive oil manufacturers will, not a lot of them, but some of them will cut the olive oil with some of these guys over here. So you have to watch out for that.
I don't do much cooking, as my wife can attest to, but I do love olive oil, so I'm glad to hear this. But hate olives, isn't that interesting?
That is interesting, but you know, we
stuff.
always talk about why the Mediterranean diet is so good.
Yeah.
It's because olive oil is one of the cornerstones of the Mediterranean diet. The problem with olive oil is you don't want to get it too high. You don't want to heat it too high because then it can lose some of its health benefits. So it's really recommended room temperature, low heat, medium heat. But if you want to cook on high temperatures, avocado oil is the way to go. So that's a good, healthy oil that's good for high heat.
Great information.
Another great information. Another thing that she recommends is sometimes coconut oil, grass-fed butter, but those do have saturated fats, and sometimes that's problematic if you're watching your cholesterol.
Good stuff. Thanks for looking out for us. And the book is called Good Energy, and you can find it wherever books are sold. Lorie, thank you again so much for being with us.
Thanks for having me.
Really appreciate it.